Foundation Module 9 UHS Modular Integrated Undergraduate Curriculum Physiology Sheikh Zayed Medical College Physiology Department. Dr. Sheen CEO and Founder Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 Edition Lecture Number 16, Integrate with Pulmonology. Learning Objectives. Describe FEV1 ratio in relation to chronic obstructive pulmonary disease restrictive lung disease. The FEV1 FVC ratio is a commonly used parameter to differentiate between obstructive and restrictive lung diseases. Chronic obstructive pulmonary disease, COPD. COPD is an obstructive lung disease state characterized by airflow limitation that is not fully reversible. COPD may include diseases that cause airflow obstruction, e.g., emphysema, chronic bronchitis, or a combination of these disorders. FEV1, forced expiratory volume in 1 second. This is the amount of air a person can forcefully exhale in the first second of a breath. FVC, forced vital capacity. This is the total amount of air a person can exhale after taking the deepest breath possible. Or inhale maximally, then exhale maximally, forcefully, and quickly. The FEV1 FVC ratio compares these two values and is expressed as a percentage. It is used to identify abnormalties in lung function. In COPD, the FEV1 FVC ratio is typically decreased, usually less than 70%, indicating obstructive ventilatory impairment. FEV1 is reduced compared to FVC. A low ratio indicates difficulty exhaling rapidly, a hallmark of obstructive lung disease. COPD leads to air trapping and reduced airflow during forced expiration. Remembering points in obstructive airway disease. FEV1 decrease. FVC normal or reduced. FEV1 FVC decrease, less than 70%. Then look at the FEV1 alone, not the ratio, to determine the severity. 2. Restrictive lung diseases, RLD, cannot get air in E.G., lung fibrosis, restricted from filling. To diagnose restrictive lung diseases 1. Check the FEV1 FVC, normal or increased. 2. Check all the volumes, FEV1, FVC, TLC, FRC, SVC, they are all decreased. Because if you have normal FEV1 FVC ratio, then it is normal or restrictive. Low FEV1 or FVC values suggest restriction, and also check all lung volumes. Check the TLC to determine the severity. In restrictive lung diseases, pulmonary fibrosis, sarcoidosis, lung expansion is more difficult due to stiffness or scarring, reducing lung volumes. Because of lung fibrosis, elasticity increases, compliance decreases. Restrictive lung diseases are characterized by a reduction in lung volumes, often due to decreased lung compliance or chest wall/respiratory muscle dysfunction. The FEV1 FVC ratio is usually greater than 0.80, 80%, in individuals with restrictive lung diseases. Remembering points in restrictive lung disease. Restricted lung expansion. Restricted inspiration plus expiration. FEV1 decrease. FVC decrease. FEV1 FVC normal or increased. Compliance decrease. Elasticity increased. Summary: a low FEV1 FVC ratio indicates obstructive diseases like COPD, while a normal or high ratio suggests restrictive lung diseases.